I'm going to give you a very whirlwind visual tour of cybersecurity in healthcare and looking at the old problem of cybersecurity, but how we have a whole lot of new challenges. I'm a very visual person, so you're going to have to really pay attention. So if you have any doubt that healthcare is affected by cybersecurity, you only need to open up a newspaper, look at a news feed, and there are countless episodes of cybersecurity breaches in healthcare, in hospitals, in primary care. And I mean, in my news feed alone, I get about 10 different ones every day. So there is an awful lot of them. And healthcare remains a target because it has healthcare data and very sensitive data about people. It has a lot of valuable information to do with research, including, obviously, at the moment, vaccines. And it has to deliver services 24/7. And if you still have any doubt about that, the Office of the Information Commissioner for Australia, the reportable data breaches gives you some idea of how many there are, or rather the percentage that are happening in Australia for healthcare. Unfortunately, what this doesn't tell you is the thousands that are not reportable and the thousands more that go undetected. So we're all aware of what critical infrastructure is, transport, water, power. But when we look at healthcare, we really need to think about it as critical infrastructure. And that is not just about emergency types of care. It's also about anywhere care is delivered, whether it is in hospitals, primary care, or now increasingly through virtual care. So the reason that I'm talking about this today is because there are many of you in this room who have experience probably in cybersecurity, in AI, in critical infrastructure, in risk management. But we need to be more aware of why we need to pay more attention to healthcare. And it is a complex situation. Not that it is more complex than other sectors, but it is complex in different ways. And also technology is changing how we do business, but it is certainly changing how we deliver healthcare. And it's a topic that's important not only to us as scientists and cybersecurity people, but also as human beings, as patients, and as people. So at the end of this morning, I hope you feel that you are more able to engage in that, or at least can see where you might be able to contribute to that. And when I talk about technology, what sort of technology am I talking about? Well, advanced surgical technology, any imaging technology, and this is where it obviously crosses into AI. Imaging is one of the areas that we have made some great inroads in with regards to AI. We have all sorts of diagnostic and monitoring technology that is used all the time. And of course, we have drug therapies and vaccines technology that is currently going on at the moment. But we also mustn't forget that we have easily recognizable technologies such as the information systems, administrative, medical records, clinical decision support systems. And then we have the digital infrastructure that actually makes all those things work. And then we have cloud platforms that people have already talked about this morning, but more of those cloud platforms include artificial intelligence and machine learning. And a lot of healthcare is now at least moving not necessarily all of its data, but some of its processing abilities into more cloud infrastructures. And then, of course, we have BYOD and any mobile technology. You only have to walk into hospital now to see that people are continually walking around looking at their phones, which includes all of the healthcare providers. But, and this is a big but that we have to remember, healthcare is not delivered by technology. Healthcare is delivered by people. And it is the focus on people that we need to really get clear, both when we talk about AI, but also to do with cybersecurity. We need to be able to connect people better and also optimize that delivery through those connections and that support. But we need to do it safely. So that's the part that we're really trying to protect. And healthcare is very data intensive. It requires a lot of that connectivity. And increasingly, we have the convergence of technologies, whether it is communications, medical devices particularly, and all of the networking. And added to that, this is a scenario that gets more and more complicated, is that we now have many applications, including this. This is the first app that was classified as software as a medical device by the FDA in the US, and it helps detection of stroke. Now, in the US, 140,000 people die each year of stroke. There are thousands and thousands more that have debilitating morbidity following that. And it's a really high cost to the health system. And the key with stroke is that it needs to be diagnosed quickly. The longer you are persistent with a stroke, the worse your outcomes are going to be. And this particular app will help actually diagnose that. And of course, we are reimagining what healthcare now looks like, partly because of COVID, but partly because we are now using technology to a much better advantage. But it does mean that when we start to look at things like virtual care and telehealth, and I'm sure some of you experienced telehealth consultations during COVID, which may have been anything like me, from a 5-minute phone call with your GP to actually full online consultations. But it's a very trustful environment. By definition, healthcare is a trustful environment. It has lots of sensitive data. You usually tell your GP your darkest secrets that you may not tell your family. But the impact of what healthcare does can be, life-threatening. It means that our clinicians and our healthcare providers are often under the pump as far as time is concerned, and sometimes in those situations financially, and cybersecurity becomes a lower priority. And to be perfectly honest, if I'm a patient in an emergency department, I would much rather that they treated me for whatever it was than tried to work out how to get through the security in their systems. So the other area in healthcare is that we really have an undertrained health IT and cybersecurity workforce, partly because we have people in IT in healthcare, but just because you're in IT doesn't mean to say that you're a cybersecurity specialist either. And our systems are complex, so that just adds to the problem. And ultimately, when we can't deliver healthcare, then we do have serious consequences. So why is healthcare still having to deal with these cybersecurity threats when we know that most of the cybersecurity threats are not necessarily new? And the reason is, there's two things. One is it's a target because of the types of records that it keeps. And opportunistic hackers now really can see it as a one-stop shop for getting all the information that you need for things like identity theft. And secondly, because cyber criminals know if you lock up systems and data, you really can start to cause some particular problems at a society level. And then, of course, we've already heard a little bit, but ransomware has been absolutely rampant in healthcare. It started with the 2017 WannaCry ransomware attack that affected the NHS particularly, but also did go around 100 countries around the world, including Australia. And the impact of that lots of surgeries and appointments were cancelled, and that has a flow-on effect, not only for the individual, but also for the healthcare system itself. And part of that is because we are using, that digitized systems that we're not really quite getting a handle on how to transfer that from a paper world to a digitized world. And then, of course, I hate to admit it, but when we were talking about the technology and there was the IBM AT, well, I go further back than that. We started off with, I started off by programming a PDP-11 and then using DEC 20s and teletypes, which half of you in this room don't even know what they are. But, this sort of technology, I hate to say it, but some of it still exists in healthcare. The WannaCry incident in the UK was a whole combination of failures, just like air crash investigators, it's a combination of failures. But one of the main ones was it was using XP and it was unpatched and it was no longer supported. So, and we have had those incidents in Australia. So because we have to store vast amounts of data and because we rely quite heavily on legacy systems, when you look at medical devices, unlike your phone that may have been developed only a few months before, medical devices have a long period of development, sometimes 10 or 20 years, and they are put in and they are expected to function for 10 or 20 years. Well, even 10 years ago, we didn't have the cybersecurity threats in any form that we have them now. And therefore, trying to protect those sorts of devices is hard because we also want them to be integrated into everything that we do. We want them to be on the network. We want to be able to get the data immediately. So those sorts of things also create some problems. And also, healthcare has a whole lot of systems. And it's complex to be able to analyse how all those systems fit together. And we don't have a very good systems of systems overview of those things. We still have, in a hospital, not only do we have hundreds and thousands of devices that are connected, but we also have tens of systems that need to interoperate together. They need to have both software interoperability as well as actually process interoperability. And it does cause a particular problem. The interdependency of applications in healthcare. It's quite surprising when you walk into hospital to see how many different software systems they actually have. It'd be nice to think they had one, but even where you have a major vendor in a lot of the large hospitals in Australia, you still have lots of other different systems that connect to that. So, you know, that becomes a bit of a problem. And one of the things that we do very badly, is integrate cybersecurity protections into workflow. And in healthcare, workflow is the major aspect. And unlike where you can no longer go into a bank and speak to somebody. If you want your money, you need to be able to go online to pay a bill. You need to do what the bank has told you need to do to get into that. That is not the way things work in healthcare. We can't go into healthcare and say, you need to change the way that you treat this particular condition because you've got to get through these security hoops to be able to do it. And quite rightly, I don't think I want them to change that either, but that's what we face in healthcare. And we also can't forget about the normal things, okay? I don't know how many of you have ever left your laptop in a taxi. I'm always leaving my glasses places. You know, all of these sorts of things are normal. And in healthcare, they occur a lot. Not that they lose a lot of laptops, but, you know, the normal things of the normal level of cybersecurity things that we talk about. We've been talking today a lot about a lot of the future things and AI, but actually, I'm really sorry, but healthcare is a long way behind in terms of cybersecurity and just doing the normal sorts of things. And then, of course, we have all the nice newer things, whether it is, you know, medical devices, IoT is becoming much more usable, not just from devices, but from apps and from the technology that we have. Our Wi-Fi networks, all of those sorts of things add to that. And increasingly, COVID-19 has changed healthcare because we now have new healthcare targets, which are usually now the pipelines and the new players in the sector that are actually supplying healthcare services that weren't doing it before. There is external pressure on organisations to make sure that if there is incidents, that healthcare recovers really quickly, and that also we've changed our social and our working environment. So that adds to that attack surface. And critically, you know, when we look at healthcare, there are two particular impacts that cybersecurity incidents have. One is it interrupts workflow, and that is detrimental. And secondly, there's a huge cost to this. When you have to deal with cybersecurity breaches, I think for 500 patients, it's about $200,000 to be able to recover from that. That is credit monitoring, alerting people, managing the recovery and all of those sorts of things. So there's a lot of things that contribute to that particular problem. And so we have to think about whether or not we are lining ourselves up for a bit of a cascading failure. And there are a couple of reasons that we also need to think about why these are not new, but we have exacerbating factors. One, people find it really difficult to follow process where it comes to cybersecurity. Design, we still have real challenges with design, and the failure in actually understanding, because most of you look the wrong way, is complex in healthcare. So that, you know, whether it's the medium, whether it's the message, whatever it is, we have to be able to deal with. I can't possibly do a presentation without including my cat. It is a cat and mouse in cybersecurity. It's always going to be. It's just at the moment, the mouse is winning rather more in healthcare than the cat. So how do we fix it? We need to talk about ducks, okay? You need to have ducks. Do your ducks in your healthcare, are they all over the place and a bit of a gaggle? Or in fact, do you follow industry standards? Do you know what those processes are? Can you identify where the points of failure are? And also, there are many, many parts to your duck conglomeration. You know, you need tolerance in your networks, you need resilience, you need mitigation factors, and then you need to have everybody under the mother duck and knowing what they're doing and where they're actually doing it. And we need to be able to proactively look at what we're doing in healthcare, even down to how many of those hundreds of thousands of medical devices have been updated. That in itself, and patching, is no small thing to try and attack in healthcare. And so really what you need is your ducks in depth, and you need an architectural framework that allows you to be able to put a framework around what is effectively quite chaotic behaviour in healthcare. And at the end of the day, you need to get your ducks in a row. And cybersecurity is important, not only because it relates to patients, but because it does relate to patients. And the fact that you cannot separate security from safety, and clinical outcomes and better use of information and technology is what we're actually all about. So from foundational security measures to the more advanced things, not even backup and recovery, but enabling healthcare is something that we really, really need to focus on. And that avoiding failure and promoting resilience is really where cybersecurity in healthcare needs to go in the future. Thank you.